right. We're back live. Dr. Mike, good morning, good afternoon. It's
good afternoon.
Good to see your bald head again.
It needs a little bit of a trim, but life gets in the way sometimes.
There is, I guess, an unspoken brotherhood amongst bald men, I think. And I bumped into this a couple of days ago when I saw a guy down in my office who's a real estate agent. And we've only met once before, just kind of in passing. He's a fellow bald brother, but we bumped into each other again. And even though we barely know each other, I guess you stop and sort of exchange pleasantries, and you can just tell that there's a special bond between bald men.
Yeah, you just give that little nod of appreciation, like, hey, we have way more testosterone than normal guys. I mean, your wife's at home, she's happy, I'm sure, happy with your performance, and it's just an unspoken thing. So I totally get it. It is.
So last week, we alluded a little bit to what we were going to talk about today. We were talking a little bit about our diagnostic process and the process that we employ within our clinics, the process of being a doctor, essentially, as doctors of chiropractic. One of the things that I've run into from time to time is, I guess, a general understanding or a general perception of what it is to be a chiropractor. And I find that a lot of the time, the interpretation of that gets jumbled up between the profession of chiropractic and chiropractic as a treatment or treatment of conditions that are within scope for a doctor of chiropractic. So you and I are both chiropractors. We're both doctors of chiropractic. And so I thought we should break this down a little bit because it might be a good way to reference it moving forward. One of the things that I can remember recently is when I've been transitioning my office across to full chiropractic operations this year. So that's all done. But one of the questions that I would get from people before that was, so does that mean you're just going to do chiropractic now? And so I think their understanding of what that means is a little different to ours because it's the profession versus what they're referring to as a treatment. So, most of the time, the understanding there is that chiropractic equals adjustment, equals manipulation. And so that's the link. But in our sense, it's much broader than that. And we refer to it as a profession rather than just a single treatment. So I thought, let's go back to a definition. Let's go back to what chiropractic means. And we can break that down for us and what it means for us to be doctors of chiropractic and how we bring that level of healthcare to solving these musculoskeletal problems.
Yeah, I mean, the label as a profession, it doesn't necessarily define the style of treatment as narrowly as people would think, right? And we're going to go through the definition here in a second. And people who have seen us, people who have seen you are going to think, yeah, this is kind of what this guy does. He does all these things, except, maybe doesn't do manipulation, but, definitively, right, we are chiropractors at heart, in a sense that that's what our education's in, that's what our licensature's in. And if you break it down, chiro means hand, right? So your main treatment modality are your hands, and that is by definition what a chiropractor does, right? When you look at the word phonetically, or I don't know the better way to describe it. And quite often it gets misinterpreted because a certain sect of the actual profession chooses to treat in a particular way. And, you're looking at the standard, 15 minutes of heat followed by an adjustment, followed by 15 minutes of ice and stim, or whatever the heck needs to be done. So, the treatment that some chiropractors do does not define the entire profession. And as you guys are going to figure out, we're very much still definitively chiropractors, even if we do not do chiropractic adjustments. So go right into it. Let's see what this definition is.
So we're going to the World Federation of Chiropractic, and the way that they have defined chiropractic is that it is a health profession, and it is concerned with the diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system and the effects of these disorders on the function of the nervous system and general health. There is an emphasis on manual treatments, including spinal adjustment and other joint and soft tissue manipulation.
Ooh, that's it, right?
That's it. That's it.
That's us, with the exception of nothing in there is nothing that we don't do or don't consider or don't take into account, right? Except perhaps the manipulation.
Yeah. I mean, if we even just look at that first sentence, it starts out by saying that it is a health profession that is concerned with the diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system.
Check.
Right. And so, this is where we come back to that. We come back to that concept that we sort of broached at the start there, where it's not just a treatment. I would argue that the diagnosis part of it is a bigger part of it, or the more important part of it, and that's what being the doctor is. That I think that's where you and I take great pride in being doctors of chiropractic, because we're diagnosticians before anything else.
Right.
And we wear a lot of hats. We're business owners. We're a lot of different things, but ultimately the thing that we probably work the hardest on is the doctoring.
Yeah, I mean, it's the clinical skill set that separates. Well, yeah, I mean, there's a lot of things that separate us, in my opinion. But at the very, very beginning, it's understanding what's actually going on. Like, you wouldn't go to a cardiologist that was just really good at pushing pills, right? You want to go to the cardiologist that first understands exactly what's going on with you, and then develops a treatment plan that is holistic, all-encompassing to rid you of that problem. But you would never go to a cardiologist that, wouldn't take your EKG, wouldn't take your vitals, wouldn't do the necessary scans, blood tests in order to figure out what's going on. Now, we're not necessarily, doing EKGs and blood tests, even though, depending on where you're at, you could easily prescribe those. Our tests are range of motion, palpatory, orthopedic. It starts with that diagnosis, and if you don't know exactly what's going on, then you've got to figure it out. And again, there are always particular situations where there is a little bit of doubt in your mind. What's the pain driver? Is it the adhesion? How much of removing this adhesion is going to get you relief? How much is gaining strength going to get you relief? But that's medicine, right? That's medicine in any particular field of it, right? There are situations where you're beyond reasonable doubt, sure, about a diagnosis. And then there are situations where, again, even your cardiologist is like, I'm pretty sure that this is going on. It's worth a shot to treat this. And I'm understanding it with about 75% certainty. And, most people would be pretty okay with that. But it always starts with that diagnosis. It's the foundation of being a clinician. It's why you come see us as opposed to the guy down the street or your best friend that knows how to crack your back, right? They're in the Marine Corps and they know how to do a decompression adjustment, or they were a paratrooper or whatever, right? There's a reason you come to us, because you can, any monkey on the street or any monkey in could adjust you without a doubt, right? I mean, it's a skill, but anybody can develop that skill set, but it takes a real disciplined individual to develop that clinical skill set in order to first come with that diagnosis, because we're doctors.
Yeah. And this is what we were talking about last week, when we mentioned that that we have a fairly robust process that occurs up front before any treatment happens. Because if we don't do this well, then the treatment is probably going to fail. It's probably in the wrong place, or it's just the wrong treatment. So we have this process up front. And look, I think this is what separates us somewhat, in many ways. But the big thing for me is that we slow things down. And I was explaining this to someone the other day when they sort of asked, well, you're a chiropractor. Why should I come and see you? And this is why, because we put our focus into this process at the start to make sure that everything that follows that has the best chance of being effective. So we slow things down. A typical initial consultation in this world of healthcare, so not just chiropractic, but you can include physiotherapy, you can include, or you call it physical therapy, you can include osteopathy. There's a number of different professions within this sphere of allied health or within musculoskeletal care. But a typical initial consult is going to run from, let's say, 45 to 60 minutes. Within that entire meeting, there's going to be a history taken. There's going to be a physical examination to rule in or out what's in the history. There's got to be a report of findings and a diagnosis delivered. And then there's still got to be time left to deliver treatment, and all within that block of time. It's crazy. It's too much to be accurate. It's too much to pay attention to details. It's too much for the doctor to be able to actually stop and to consider the data that he's collected, or she, sorry, ladies, to be able to stop and consider that data and then actually think about the next step. What do I need to do next to actually be accurate here? Have I missed anything? Do I need to pass anything out further? It's very, very hard to do that with a high level of accuracy when you're on the clock like that and you're just flowing through to the next one. So our process actually breaks these things down, and we actually take a little bit of time in between each one just to stop and just to consider it and just to think, because we don't want to miss anything. Sure. And we want to be as right as we possibly can. And, we even take it to the level where we don't do all of these things on the same day. And that's how we actually get a higher level of accuracy, so that when you have been through that process, you've done your initial consultation, you've been through a comprehensive examination, and we've been able to deliver a report of findings that is meaningful and hopefully accurate by that stage. And then the treatment that's going to follow that is going to be addressing the actual problem. So that, to me, I think is how we're a little bit different, but I think it's different in all the right ways, because if we are by definition a profession that is concerned with diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system, then we need to do that with a high level of accuracy, and that's how we do it.
Yeah, I completely agree with you, and we do it in that way because we know it to be the most accurate, not necessarily the most efficient way to obtain insurance returns, right? I mean, at the end of the day, a lot of the speed at which a lot of these practitioners operate is, first of all, a function of maybe a lack of knowledge or understanding of what they should be looking for. But number two, it's how do we maximize as many codes, as much billing as we possibly can into any given situation. So, you and I, we take 15 minutes in a consultation, and we don't even touch a patient. We don't even examine them. We don't even look at them. We do that because we want to consider what you talked about during that consultation and then build an actual exam that's perfectly tailored to you. We don't treat during an exam, right? We do some diagnostic passes if necessary, but it's mostly palpatory, range of motion, and orthopedic. We do that because it's the best way to do it. It gets us the best types of patients, and then we're not pressured by any external sources in order to pack as many codes as possible in that thing. And this is something that always kind of bothered me, going through chiropractic school, is people saying, oh, you're not real doctors, right? You know what I mean? It's one of those things that just irks you a little bit, and that's understandable. And I get it. But if you are not having a tissue specific diagnosis and you're not sitting there doing what we are doing, you are not a real doctor. Like I can't stress it enough. People look at a chiropractor and they said, not real doctors. And I'll say, yeah, most of them, 95% of them, 98% of them, because they're not doing that diagnostic step, right? They're not doing something that's in the first sentence of the definition of their profession. So no, if you are not fulfilling that role, then you're not a real doctor. So that I had to get that off my chest. What's the next sentence? Let's move on.
So it talks about beyond managing. So it's got, treatment and prevention of mechanical disorders. Okay. And then it goes to the effects of these disorders on the function of the nervous system and general health. So I guess that's where it starts to kind of take that direction a little bit in the traditional chiropractic sense.
Sure.
However, I would argue that, we're very much concerned with the nervous system. And especially in our skill set, one of the things that we take great pride in is dealing with nerve entrapments, peripheral nerve entrapments, because it's such a big problem. It's mostly undiagnosed and untreated in other settings. And it can be life-changing for people when they get that dealt with effectively. So certainly we're concerned with the nervous system and the health and the function of the nervous system. But I think perhaps we're looking at it and being concerned with it in a slightly different way to maybe how that definition was intended.
Sure. And just to be clear, like the traditional definition of affecting the nervous system, you're going to look at, a chiropractic manipulation and how it will push somebody into, a more of a, rest and digest state of their autonomic nervous system. And then you're also looking at like an even more traditional way of checking this out is, it's called the Merrick chart, right? Where it's like certain organs are tied to certain spinal levels, and then by manipulating those certain spinal levels, you will then stimulate those organs. So for me, when I look at that, that's like Merrick chart for me is an absolute no-go. Now, does my treatment help alleviate pain and maybe take people out of a fight or flight response? Probably, right? Like, is having pain stressful? Yes. Is removing people's pain make them less stressed? Absolutely. I mean, any doctor is looking at the effects of the nervous system because the nervous system controls everything. So the intention of the definition is not really to align with the way that we do things. But I mean, your cardiologist is concerned with your nervous system. He's not a neurologist. Your gastroenterologist is concerned with your nervous system, right? Probably more so than your cardiologist because of, the effects on stress hormones and digestion and all that other fun jazz. But yeah, we're concerned about it. And, we know a substantial amount about the nervous system, right? We know that, depending on what part of your body is tingling, burning, what it's likely to be the cause of. Is it a centralized space occupying lesion at a nerve root in the spine? Is it a peripheral nerve entrapment? Is it, inflammation touching a nerve root and causing a peripheral or kind of a central peripheralized response? So it's like, we're concerned with that. It's excellent data. We're looking to fix that. And that line between what is the nervous system and what is not the nervous system, in the body is blurred. It's almost impossible to differentiate that. So yeah, we are concerned, but not in the traditional, I'm going to adjust your T4 and cure your diabetes type way.
Yeah. And that's where some of these definitions come back to, you hear about the innate flow of the body and those sorts of words get used. So that sort of sits, I think, a little bit more within this sentence because, they even take it as far as, as general health. And I guess you could interpret that anyway. Obviously, if you don't have as much issues in your mechanical system, then you're going to have better general health as well. I think we can extrapolate that out, and we'd agree with that. But it just depends on the interpretation here, because the other way of looking at it is that some practitioners would argue that adjusting joints to optimize the nervous system is the way that you would encourage better health in general. So it's a little bit open, this statement, I guess.
It is, and we're concerned with general health too. Like, I talk to people about sleep all the time. I talk to people about stress management all the time. I talk to people about nutrition all the time. I'm not actively embarking on any active care plans to fix those things specifically, but we understand the effects that general health can have on your joint pain, right? If you're sleeping like shit and your back hurts, right, it's not going to fix your back, but getting 8 hours of sleep that next night is certainly going to make it not feel as cranky. So we're concerned about everything on here so far. It's just the way that we're interpreting it as a little more evidence-based than philosophically based. And I mean, we've done this before where we went into what the adjustment actually is and what that innate flow actually is, but that's not what we're after. I'll make the fucking innate flow so well over you. It'll wash over you like a beautiful Australian wave. But what's going to happen when that innate flow stops flowing, right? What's going to happen when that proprioceptive overload starts to slow down and the pain fibers kick back in? You're going to be in the same position as you were 20 minutes ago, which is why people are like, chiropractic feels good for 20 minutes, 2 days to 2 weeks, and then it goes away. So next.
Yeah, I like where you went there with, sleep and just general aspects of life like that, because that, I ask a lot of questions about that as well. So when we're going through that intake process and we talk about how we care about details, those are some of the details that I'm really interested in, because understanding that person's complete health picture helps us to understand how we can help them, or what the recovery from their injury is going to be like. If you're only sleeping 3 to 4 hours a night consistently and you're living on coffee and energy drinks, then you're not going to heal as fast as someone that's got a different kind of sleep hygiene practice. So, those things are really important. There's a bunch of other questions that we dive into as well that sometimes people kind of look at you like, what do you need to know that for? But it all matters. It's all part of building up this whole health profile, because it helps us understand how we can help you. So it's certainly not to pry into your personal life at any stage, but it does help us understand how we can manage your condition. All right. So we got the last sentence here in this definition, and this is where it gets into the treatment. So it talks about an emphasis on manual treatments. So we've discussed that already. And that includes spinal adjustment and other joint and soft tissue manipulation. So, I mean,
it's kind of murky.
It is.
Like, what's the difference between manual therapy and soft tissue therapy? Like, it's the same thing, right?
It does. You could just say an emphasis on manual treatments, I guess, and that would kind of cover it all. But yeah, I mean, makes sense to me. It leaves it very open. It addresses what we do.
That's it. We do manual therapy. We do soft tissue work. And again, like, if the diagnosis fits an adjustment providing long-term relief, I am not diametrically opposed to providing somebody with an adjustment, right? If you come in and you've got a meniscoid entrapment, right?
Got to get it out of there somehow.
I'm going to pop the living shit out of your joint, release that meniscoid, which again is like a little cartilaginous flap that can happen in between your zygohypophyseal joints. But I'm going to adjust you and we're going to leave. We don't adjust, not because we hate adjustments, not because we were bitter at the experience that we got in school, not because we think we're better than other chiropractors, which we are, right? I mean, objectively, right? Because we've done all that stuff beforehand, right? I'm not saying I'm, better at anything except actually coming to a medical diagnosis and being a real human being. But if the glove fits, I will adjust you, right? If the glove fits, you must acquit, right? O.J. Simpson style, I will adjust you.
That's the point of the diagnosis, isn't it? So,
right.
We get to that point where we have a diagnosis and then we have to retrofit a treatment to address that. So exactly right. I couldn't agree more. It's just that in most of the cases that we deal with, that's not what is indicated.
Right. And even, some, like if I've had a patient for a year and a half or 2 years and they've been on maintenance for a year and they're doing great and they say, "Hey doc, could you give me an adjustment?" I'm probably going to give that person an adjustment as long as it's not contraindicated, because I know it's not going to mask any of their symptoms. They're genuinely curious and it feels good. So to me, I'm more likely to adjust that person, the guy that comes in for a consultation. He's like, "Aren't you going to adjust me, doc? When are you going to adjust me? What are you going to do?" It's like, no, I'm not going to adjust you because it's not going to fix your problem. When you're a maintenance patient and we fix your problem and we're just trying to maintain or promote longevity, right? Yeah, doc, can you adjust me? Sure, why not? I'm not gonna sit here and be like, "Yeah, we really need to adjust you today. It's gonna be super healthy for your back." But like, curiosity killed the cat. I'll let you rip. Why not?
There's been a lot of at least twice this week that I've seen it in the media, and so this was just on Facebook, on social media, but some satirical articles get published, and it's these two were about chiropractors and the fact that it was like shonky business behaviors. I'll just say that much. But I'm always interested to have a look at the comments that follow that, just to kind of get a flavor for what people are saying. It's always interesting. And I was kind of shocked at the level of negativity that followed it, and not stories because they're just short form, but people's comments of their own experiences and stuff like that. I mean, there was nothing positive. It was all negative. And I get that's often what happens in those situations. People like to jump on and do that sort of thing. But it was kind of shocking to me to see that, I think, because it just, like, it was long. It just kept on rolling. And I kind of just gave up after a while because I didn't want to keep reading it. But, I think that's kind of what we're up against.
And deservedly so. Like, we need to be clear about that as well. The profession as a whole deserves every bit of ridicule. A lot of the satire is well-deserved. And, there's a reason why you and I have distanced ourselves from the actual profession, right? There's a reason why I put my chiropractic diploma above the toilet in my bathroom. So when you're taking a piss, you see, oh, wow, Michael Anthony Vancheri graduated from the National University of Health Sciences, because as much as that diploma has afforded me, opportunities, and it's allowed me to live out my dream, the diploma itself is satirical in its own way, right? I mean, we get this thing and it's fucking worth nothing. And it's fucking worth nothing because that satire is based off the education that we received. And the average run-of-the-mill chiropractor is either got some kind of crafty marketing ploy or is finding, someone, and I don't want to say everybody. I'll say how do I want to put this? I don't think they help people long term. I don't. And that's the biggest beef with chiropractors, is we're sleazy and we don't help people long term. And we've literally designed our practice to be the exact opposite of that. And there's a reason we did that. And, there's a reason why people don't do it that way, because it's very, very difficult. But, chiropractors deserve every bit of flack that they get, because the profession itself is an absolute fucking joke. Unfortunately, you need some type of license in order to treat patients legally, right, in our in our countries.
Yeah, and if you're a prospective patient that finds this podcast, this video somewhere down the track, and you're doing your research on us and what we do, and considering working with us, then you should know that we work really hard to provide the highest level of healthcare that we can in this musculoskeletal space. And we have had to go through that process that Mike talked about to get that piece of paper. And then we've had to kind of put that aside and start work again. And it's been a whole new investment of time, of money. It's a gigantic challenge, and it's something that I think we just wouldn't have any other way, because it's how we can deliver a high level of healthcare that we're comfortable with. And so if you're thinking about potentially working with us, and you know that we're chiropractors, and that makes you a little bit uncomfortable, because that is something that people have said to me, they're almost fearful of working with a chiropractor. Rest assured that we work really hard to deliver a level of healthcare that is appropriate to your condition. And we work hard on that every single day. We work hard in a lot of different aspects. We work hard from a business perspective. We work hard from, just the fact that we do this really is because we help each other, and we try to get our message across so that it's in a format that is palatable. Because sometimes people read that chiropractor, or that, they see that word and you've already lost them. So granted that this is quite a long-winded way to explain this, but I hope that it goes some way to explaining what we do and the values that we hold.
And let's be clear, you and I are lucky because we were in a position that a lot of people are in when they get into this profession, is they genuinely have good hearts, and they genuinely want to fix people, and they genuinely want to provide for their family in an honest and ethical way. And you and I are lucky enough to have found a way to take what we've learned and to actually apply it in a way that achieves those goals. Now, most people aren't that lucky, right? There's a reason that the attrition rate of the chiropractic profession is so high, because for every 100 people that go to chiropractic school and graduate, right, 10 years later, there's only 50 people practicing. And there's only 50 people practicing because 50 other people realized this is bullshit. And, maybe the other 50 people are really, really good at their job, or found a way to look themselves in the mirror and say, it's okay, or have stumbled upon something that is relatively similar to what we do, although nothing is on this level, and they're still in it, right? I mean, how many cardiologists are done after 10 years? You know what I mean? It's just not the same, because there's almost this feeling when you graduate that you've been lied to, right? This bitterness that builds up. You're like, man, fuck this, right? It's all a bunch of horse shit, which at the end of the day, a lot of it is. And you're ill-equipped to handle patients, and you're ill-equipped to fix people. And how many times do you not fix somebody before you give up, right? Or in you and I's case, right, find a different way to get after it. And again, we're blessed to have wonderful ethics. But yeah, it's a bit sad, right? Especially since I'm coming up, 5 years on, my graduation, and I'm wondering who's still going to be rocking and rolling in 5 years that I loved in school. So that's my 2 cents there. I wanted to be clear that not everybody is a skis ball. There are quite a bit of them, maybe a higher percentage than any other profession outside of used car salesmen. But, Yeah, you feel bad because people genuinely get burned.
Yeah, look, all we can control is what we do ourselves. And you mentioned looking in the mirror, and I want to be able to stand there in the mirror and be happy with the man that looks back at me each day. And um, you know, there's still a lot of work to do, but we're on the right path.
And I've got 70 years to do it because I'm going to be pain free at 100.
That's it. We're another week down, another episode down. We're on our way to being pain free at 100. All right, folks. So we'll wrap it up there. We'll see you again next week.
Have a good one, my beautiful people.